Good evening and welcome to our COVID-19 update. I'm Ladi Akere-Doluale. Here are the highlights at this hour. Labour and Employment Minister Chris Ngige appeals to resident doctors to embrace dialogue as they embark on nationwide indefinite strike today. Nigeria's COVID-19 figures now more than 55,000, even as the NCDC has been reporting cases below 300 within the last 2 weeks. And India now has the second highest number of COVID-19 cases in the world after the United States. We begin tonight with the story of the resident doctors who today embarked on an indefinite strike nationwide. The doctors say this action is the resumption of a strike which was suspended in June of 2020 to give the federal government a chance to meet their demands. They claim the federal government has been slow in meeting some of the demands and not forthcoming at all in others, which include the payment of COVID-19 allowances and inducements and the implementation of the Residency Training Act. The strike does not appear to exempt doctors directly involved with COVID-19 patients.
It's a carefree atmosphere at the Lagos State University Teaching Hospital, Ikeja, in southwest Nigeria, as doctors relax and banter in their lounge. The nationwide strike has just begun, and they say there's no going back until demands are met. This is a strike at all levels of care.
It's a yearly problem which has to do with salary disparity amongst doctors. So you find that especially between states and federal doctors.
A similar scenario at the Lagos University Teaching Hospital gives a more national picture of the struggle.
What we are agitating for was an agreement by the government to actually implement that Medical Residency Training Act. And the last of them all is the COVID-19 inducement allowance, which was paid to some centers, of which even in those centers, some individuals or some other individuals from all other health cadres did not get.
Patients present themselves for medical treatment at the Federal Medical Center in Ogun State, but the doctors are conspicuously absent from their duty posts. The head of clinical services is concerned this might have dire implications for the fight against COVID-19.
The COVID is still here with us, even though the curve is flattening gradually. We wanted this to be sustained.
Parts of the Federal Medical Center, Owerri, Imo State, in southeast Nigeria, are deserted owing to the strike. According to the Medical and Dental Council, there are about 16,000 resident doctors on the National Register, constituting about 40% of the total workforce. Now that consultants and nurses must fill in for them, how long can care be sustained for the teeming patients here in Abuja, the nation's capital, where the strike began 6 days ahead of other institutions? Some say the percentage of resident doctors is even higher, like here in Taraba State.
The less than 20% that will be on ground, definitely it will be a challenge for them.
In Katsina State, the northwest region, over 300 resident doctors have downed tools. Work continues in Yobe State in the northeast, while doctors and patients alike wait for the results of an ongoing meeting of the professional body. When asked if those who work in isolation centers are exempted from the strike, the doctors say no such provision has been made. As always, it's a stalemate with patients' lives at stake and the public waiting to see who will blink first.
Meanwhile, the Minister of Labour and Employment, Dr. Chris Ngige, is reconvening a conciliation meeting between the resident doctors, the Federal Ministry of Health, and the Federal Ministry of Finance, Budget and National Planning. According to the minister, the meeting is slated for noon on Wednesday, September the 9th, at the conference room of the Honorable Minister's office in Abuja, with the Nigerian Medical Association expected to be in attendance. Dr. Ngige had earlier in a statement appealed to the union to embrace dialogue to resolve outstanding issues. He explained that even with the lean resources due to the COVID-19 effects on oil output and price, the federal government had addressed the majority of the doctors' demands. A member of the Adamawa State COVID-19 Committee and chairman of the Christian Association of Nigeria, Adamawa State Chapter, Bishop Damim Mamza, has asked Nigerians to take the necessary precautionary measures, especially by complying with the COVID-19 protocols, insisting that the COVID-19 virus is not a death sentence, but that many had died due to fear and panic. Bishop Mamza, who was infected, has now been certified free of COVID-19 after testing negative to the virus. The clergyman made this known during a media briefing in Yola, the Adamawa State capital. The Catholic Bishop of Yola Diocese also appealed to Nigerians to continue to pray until the disease is finally defeated.
In the first place, I think Nigerians need to appreciate more and more the efforts of the health workers, those in the front line, those that go out to collect the samples, those that work in the lab in order to make sure that they do the test, and then the doctors and nurses and other workers that go to the treatment centers. They really need to be appreciated. And that's why I feel very sad, like I had it over the news this morning, that from Monday, the medical doctors will be going on strike. It's very sad. This is not when such thing should happen. The government should please attend to the needs of the doctors immediately so that there should be no strike. We don't have to allow strike to begin and then before you begin to find solutions to problems. Because there is no strike that takes place in Nigeria that will not lose life. And the life of every person is very, very important. So I call on the government to please attend to the needs of the medical personnel so that there will be no strike in the coming week.
In spite of the campaigns on the importance of observing safety guidelines in order to curb the spread of COVID-19, many residents of Bauchi State go about their daily businesses doubting its existence. Channels Television's crew went around the state today, the capital in particular, and found out that many are still in doubt, revealing that more needs to be done to enlighten the public. Our correspondent, Hajira Aliu, tells us more.
This is Winty Market Bauchi. There's so much interaction going on between buyers and sellers without the use of face masks. In fact, people like us who still use the face masks are being regarded as taking the virus too seriously. We hear passing comments like, does the coronavirus still exist? Why are people still wearing the face masks? Let's find out from both buyers and sellers why they don't take the use of face masks seriously.
Some people have complained of being suffocated because of the use of the face mask. And secondly, people are saying that why is this corona only hard from people that are rich, people that has money. And nobody have seen this, just like a rumor. People don't believe in it again, that truly there is corona. Because you see people going around, going everywhere. Some people that have been isolated that they have corona. Some of them are even just rejoicing there as if there's nothing. And this corona, we believe they said it kills people. Why are people having it and are going around freely without any problem?
I'm with one of the shop owners in Winty Market. Let's hear his response. Why don't you use the face mask, given the fact that you interact with a lot of people every day?
Well, it's not that I don't believe in corona, but corona here in Nigeria, or let me talk specifically in Bauchi, I don't think there is corona in Bauchi.
Why do you think so?
Because I have never seen a single patient of coronavirus. I have never seen. With my own eyes, see corona patient.
That's his opinion. Unfortunately, even the law enforcement agencies have relaxed in enforcing the use of face masks and other safety protocols. From Bauchi Winty Market, Hajira Aliu for COVID-19 updates.
Same situation exists in Maiduguri, the Borno State capital, where for many, life has returned to normal. Residents now go about their daily lives without recourse to the danger of the spread of COVID-19. Safety guidelines are now forgotten as livelihood continues with all sectors of the state fully functional. Blessing Chuno Aso sampled the opinion of residents about their reluctance in observing prescribed protocols.
In Maiduguri, it does seem like the people have moved on and fewer people are worried about contracting the coronavirus. How do we know this? This can easily be determined by the number of people wearing face masks, maintaining physical distancing, and observing safety protocols. It is not clear if these are denial signs or the people already believe that they have it all figured out. But one thing that is very clear at this moment is that the initial scare and trepidation is gone.
We are going to enter a car, napep, everything without masks, hand sanitizer, because we take it for granted. But we are suffering about the insecurity. So everybody is now worried about the insecurity, not coronavirus in Maiduguri.
The government hardly talks about it, and for the few residents we have been talking to, this might just be another closed chapter.
To me, I believe that all of them knows that corona exists, it's reality. But the basic thing for them is they want to have a life to live. And if you don't eat, nothing you can do. So the best thing for the government, I would say, is to enlighten people more about this coronavirus and find a way that at least it will remit what they are looking for.
We also understand that these days, people voluntarily walk into testing centers asking for their samples to be taken. And we also understand that fewer or none of the samples come back positive, which could also be responsible for the I don't care attitude of the residents. From Maiduguri, the Borno state capital, I am Blessing Chuno Aso for COVID-19 updates.
Now, one of the ways through which all this, to quote Blessing Aso there, I don't care attitude will not come back to bite many of those who are exhibiting it, is if the world came up with a vaccine sooner than later. Joining me now in the studio is a doctor of pharmacy and fellow of the Pharmaceutical Society of Nigeria. Dr. Lolojo, thank you so much for your time. Welcome to the studio.
Thank you.
The issue of vaccine has both been straightforward, but at the same time, controversial. The week that ended, we had the story that the Russians had made their vaccine available to Nigeria, something that was later on denied. We were told that it was just the documents. But Russian, English, American, Chinese, if a vaccine should come here, what do we need to do before we apply it to the general public?
Well, thank you so much. The race for COVID vaccine is on. And I think as of today, there are about 176 candidates, and 36 of which are already been tried in human. Yeah, the Russian vaccine that seemed to be controversial is known to science too. Is accelerated process. But the truth of the matter is that vaccines take years for development in a normal condition. But these are not normal conditions. And we have faced abnormal issues like this before during the HIV crisis, real trouble. And you can see so many organizations, pharmaceutical companies, really running for us to get something so that our people will not die. So the Russian vaccines, what they did was to combine phase 1 and phase 2 of the clinical trial study together. They are not, there are established, protocols and
as to how to
go about it. But in this particular case, they say, hey, we have tested this thing, it has shown promise, it has shown result, therefore we want to start using it. Okay, have we received it? We saw in the news that we have received samples. That is what we are told. And these samples came with some documents. Now, under normal condition, even if you are not treating HIV, Ebola, or COVID-19, once it is a new drug, it has to be tested here. Because apart from these phase 1, 2, 3, 4 studies, there is still what we call post-marketing studies. So if it comes to Nigeria, we will approach NAFDAC. I have this new product. And NAFDAC will say you have to do clinical trial. We want to see whether it will do the same thing that it's been doing from where it comes from. So normally, whether it's from Russia, whether it's from Europe, whether it's from America, if it comes here newly and it's new molecule, new drug, it has to be tested. That's the rule.
Now, given the fact that it does appear as if people are very anxious, as you talked about it, I said the Russians combined stages, you know how to quickly get to the front of the queue, if you like.
Yeah.
At this stage here, isn't it dangerous for us to follow those lines and maybe also do our own a bit fast so that if it proves the way we want it to prove, we can start using it?
You are right, but we don't need to rush like the Russians. Anyway, it has come, and it's going to come with documents. And thank God, the lady or the senior lady at the M of NAFDAC affair is an investigator herself. So she knows all these things. Even personally, she's an investigator before she became the DG of NAFDAC. So they're going to study whatever document come with the sample that the Russians have given to us, and they'll be able to determine what is the next thing that we do. They're not going to start from ground zero, like we're trying to determine the dose response, dose side effect, and all those, All they would need to do is to say, does it do what they have said it will do? And what does vaccine do? Vaccine is just to teach the body how to respond when it's challenged. That's what vaccines does. Once you use it, we will not have time to go into the detail, but once you use it, the body is challenged, and in the process of being challenged, it produces what we call antibodies.
Right.
And this is stored in the memory of the cells that are doing this. So when the real challenge now comes, there is a refresh button that the body presses and is able to produce those antibodies to neutralize whatever challenge that it has.
The other side of this, which I wanted you to talk about, is that whichever vaccine shows up, there will also be the question of distribution and cost. Last week, again, we did hear that Africa is slated to, or has been allocated 220 million doses. And over the weekend, I had a discussion where someone pointed out to me that Nigeria alone could take that entire 220 million doses for itself, which also brings up the issue of how do you equitably distribute this and how do you pay for it? The vice president was saying, look, there isn't any money. We don't really have money. And so we are not in a position to pre-order like many other countries are doing, Australia, the US, Britain. What, in your own view, is the way we should go about this to ensure that we are not left behind if some breakthrough medical invention comes up that can help this matter?
Yeah, we are not going to be left behind because the world is interconnected now. And the truth of the matter is that we have people who are running the affairs of the state and they are sensitive to what is going on. In fact, this one that you are talking about, the Russian vaccine that has come or other sample or whatever it is, we asked for it. Up till now, experts in Europe, experts in America, they are still raising concern. They are still saying, hey, this Russian vaccine, is it going to be good? Is it not? But Nigerian government asked for it. And now it's with us. There is collaboration between Nigerian government and Russian government. Somehow we will get it. When are we going to get it? These are questions that we sort itself out. Now, in terms of cost, as it is today, if you contract this COVID-19 virus, yes, it's not a death sentence, and we need to know that, but there are still deaths. From the figures that I have now, as at 5th September 2020, we have done about 422,000 tests. Guess what? This 422,000 tests is 0.027% of our population at 200 million. Okay? Now, we have, as at today, confirmed cases of about 54,905, which is 30% of what is tested.
Right.
Okay? But only 1.9% of death that we have recorded. 78% have recovered. So what we're saying is that, look, if you do more tests, are we going to discover more
cases?
More cases? So what exactly is the level of this problem where we are right now? We don't actually know because of but all we can say, given the figure that we are saying, it is flattening. Among the population, the fear factor is disappearing. Oh, I went to Osun State the weekend before now. And when they want to greet you, they want to hug you. I said, no, I do like this. I said, no, you are Lagosian, it's you that have coronavirus. We don't have it here. So the fear factor is actually going down. The curve is flattening. The cost will be there. Hey, if there is a solution, the other problem will be cost. There will be a solution to that one too. But let's have the solution first.
I hope that, of course,
There
our
will be.
optimism will continue.
There will be.
All right,
There will be.
Dr. Lolojo, thank you so
Yeah.
much for being with us
Thank
this
God.
evening. Thank you for your time.
Thank you.
Thank you for
Thank you.
appearing on the
All
program.
right, yes.
We'll take a break. When we'll come back, we'll bring you the very latest on the figures that we've just been talking about where Nigeria stands with its case management. Please stay on with us. Thanks for staying tuned. Welcome back to our COVID-19 update. Nigeria has exceeded the 55,000 mark of confirmed cases of COVID-19 after 100 cases of the virus were reported by the Nigeria Center for Disease Control, the NCDC, last night from 9 states and the FCT. With Lagos recording 39, the FCT 22, Kaduna 19, Oyo 7, Ebonyi 6, Edo 3, Katsina, Ekiti, Bauchi, and Nasarawa 1 each. It's the country's lowest daily figure in almost 5 months. Total number of infections active, that is on admission, dropped to 10,935, while 43,013 persons have recovered. The nation has lost 1,057 people to the disease. For about 2 weeks, Nigeria has been reporting cases below 300, indicating a possible slowing of the disease in the country, which experts have also ascribed to low testing across the nation. According to the Presidential Task Force on COVID-19, collection of samples declined grossly in at least 6 states across the country in August. The number of deaths from the virus has also been low. Sunday's figure also represents a decline of about 40% from the 745, Nigeria's highest daily infections rate, which was reported in late June. In Imo State, the government there is intensifying efforts in its fight against the COVID-19 pandemic. Through the Ministry of Health, it is scaling up testing by coming up with new initiatives to achieve this. Eitope Kuteyi, our correspondent in Owerri, has the details.
The Imo State government has launched a community mass testing program for COVID-19 through a mobile testing laboratory, also known as Wellness on Wheels. During the launch of the mobile testing laboratory at the Imo State Specialist Hospital in Owerri, the Imo State capital, the Commissioner for Health, Damaris Osunkwo, says the government is partnering with the NCDC, the WHO, and the KNCV Foundation to achieve this feat. She says our team will tour the 27 local government areas of Imo State, and at least 500 persons will be tested in each local government. This is to achieve the NCDC directives that 1% of the state's population should be tested for COVID-19.
By going to the local government, it's going to tell us the people who have it, and also let the world know whether we have so much or we don't have so much. The difference between this local government and the other local government. Sometimes you have much in municipal, you might not have much in another local government. And then those that have it, we can take them. We have about 6 isolation centers and treatment centers. We cannot keep them there. Treatment is free, feeding is free. So that by the time we finish this community testing, we are just scaling it up. We have been doing it, but now we are going to capture all the local government and get those people who are ill. It's not a death sentence. We can isolate them. If they have a good housing, they can stay in their house. If they don't have, we take them to the treatment center. The drugs given free, food given free. After 14 days, most times they are okay. Even before 14 days, they can go back to their houses.
Hopefully, Imo indigenes will take advantage of this new development, as it will go a long way to contain the spread of COVID-19 in the state. From Owerri, the Imo State capital, Eitope Kuteyi for COVID-19 update.
Thank you, Eitope. Some news just in. The Ogun State government has announced Monday, 21st of September 2020 for the reopening of schools in the state for the first term of the 2020-2021 session, in addition to the earlier resumption of students in SS3 who are currently writing the West African School Certificate examinations. In a press statement issued in Abeokuta by Kunle Shomori, Chief Press Secretary to Governor Dapo Abiodun, it was announced that this second phase of the reopening of schools is extended to all classes of primary and secondary schools, technical and vocational colleges, as well as tertiary institutions. However, as part of the efforts to meet the COVID-19 guidelines for school operations, the school hours are to be staggered. Private schools are also expected to take necessary measures to meet the COVID-19 protocols for physical distancing. The government had earlier announced that all students had been given automatic promotion to the next class, including automatic placements for primary 6 students in public primary schools into GSS 1 of public secondary schools. However, primary 6 students desirous of placement into the state-owned boarding schools will sit for the common entrance examination on Saturday, the 12th of September, 2020. Let's talk now to the chair of the Africa COVID-19 Vaccine Manufacturing Initiative. He is himself, of course, a vaccinologist. I'm talking about Mr. Simon Agwale. Mr. Agwale joins us from Maryland in the United States of America. Good evening, and thank you for your time on the program today.
Good evening, and thank you for inviting me.
Africa's search for COVID-19 vaccine. We have heard what is going on in Russia. We have heard about Europe. We've heard about the Americas, but not too much about Africa. Where are we with that?
Well, I think it's unfortunate that we're talking about other vaccines. What we ought to be talking about is how we can develop these and produce these vaccines locally in Nigeria and Africa. As you can see, if you look at the landscape, we have 2 functional vaccine manufacturing capabilities in Africa. One in Senegal, and Senegal makes only yellow fever vaccine. They have end-to-end vaccine manufacturing capability. And then the number of doses that they produce every year is just 7 million doses. They are in the process of expanding that capability now to about 30 million doses. And all that will be for the manufacturing of yellow fever vaccine. Because even with the 30 million doses, they are not even able to meet WHO demand. Then the South Africa is basically doing fill and finish. They are expanding their capacity now to produce 30 million doses of vaccines per annum. They are in discussion now with other manufacturers to see how they can finish the COVID-19 vaccines in South Africa. That capacity, as you can see, is even if they are successful in getting the products of fill and finish in South Africa, it will only cover about 10 to 15% of that population per annum. So how long will it take them to vaccinate the entire South Africa, not to talk of other African countries? So it is just unfortunate. I hope that we can use this opportunity to start talking about building our own capabilities in Nigeria so that we can develop our vaccines, produce these things, and be sure that we have access to this product. Now, coming to the Russian vaccine, there's a process. It takes about 10 years to develop a vaccine. You start from exploration because there are different methods that you can deliver the vaccines. We already know that if you target the spike protein of the SARS-CoV-2, if you make antibodies to that, you protect the virus from entering the cell. So every vaccine manufacturer is using the available technologies to deliver that particular protein so that you can make antibodies to prevent infection. Now, once you figure that out, you have the next step, which is the preclinical testing. Preclinical testing is in animals. So you have 2 animal models, small animals like mice and then monkeys. So here you are testing to see whether the vaccines will make the right immune response and then you can challenge those animal models, especially monkeys, to see whether the antibodies protect against that vaccine. Then you move to the next step. So once you are able to figure that out, then you can now apply to the regulatory agency to do clinical trials in humans based on the safety and immunogenicity that you've gotten in the preclinical testing. Once you get that approval, you do what we call phase 1 trial. Phase 1 is small population because you are not sure of the safety of the vaccine. So you subject about 20, 30 people to the vaccines and monitor whether the vaccine is safe. Then you move to phase 2, which is looking at the expanded safety and whether the vaccine is inducing the right immune response. Once you do that, then you can now move to the last phase of clinical trials, which is the phase 3, and that is recruiting thousands of people to see whether the vaccine in this real-life situation will be safe and protective against the pathogen. And once you finish that, then you can now apply to the regulatory agency for the vaccines to be licensed. Then you can now manufacture the vaccine for you. So it takes about 10 years. But because of COVID, that entire process has been reduced to about 12 to 18 months without compromising the scientific integrity. So the Russian vaccine has gone through, and how is this done? The COVID, most of the phases are overlapping each other. Like you can do the animal studies phase 1, phase 2, and then while you're doing your phase 2, you can be manufacturing the vaccine. You don't even know whether the vaccines will work or not. And that's what the US is doing. They have pumped billions of dollars to various companies to start manufacturing the vaccines before you know whether the vaccine will work or not. So we compress that. So the Russian vaccine has gone through phases 1, phases 2, just like the 29 vaccines that are in clinical trials induce the right immune response, 100% immune response, neutralizing antibodies. But you will not know whether this immune response will protect or not. That's why you have to do phase 3 trials in thousands of people. So it is premature for us to embrace a product that has not finished going through the various stages of clinical trials. I think what I have to be corrected, what the government wants to do is to see whether we can be part of the phase 3 clinical trials. Because Russia, the Minister of Health last week announced that they are recruiting 40,000 people for phase 3 clinical trials. So maybe Nigeria wants to be part of that 40,000, contribute to the phase 3 clinical trials of the vaccine. But right now, you cannot use a vaccine that has not gone through the entire process of clinical trials.
All right, then. Thank you very much, Mr. Simon Ogbale, Chair of the Africa COVID-19 Vaccine Manufacturing Initiative. I'm sure the authorities are listening as you speak there. Let's go to South Africa itself. The number of confirmed COVID-19 cases there stood at 1,293,048 on Monday as the continent continues to see a rise in infections. South Africa remains the hardest hit country on the continent, having reported more than 630,000 confirmed cases and almost 15,000 deaths. The figures represent 49.4% of Africa's caseload and 47.9% of its fatalities. Our South Africa Bureau Chief, Betty Dibia, gives us an update on the COVID-19 figures from South Africa.
Contrary to expectations from COVID watchers, the President's weekly newsletter for this week dwelt mainly on gender-based violence and what's being done about it in the country to protect victims and also prevent cases. But the COVID stats for the country shows an increase in recovery rate to 88%. According to the Health Department, 1,633 new cases were recorded between Saturday and Sunday. While the average daily increase in confirmed cases has reduced significantly, the number of COVID-related deaths in a 24-hour cycle has continued to stay above 100, with the highest fatalities recorded so far in the Western Cape province. Gauteng province remains the epicenter with over 20,000 active cases. While South Africa has improved in the global ranking in terms of the number of confirmed cases, the country ranks number 13 for the cumulative number of COVID-related deaths recorded. Added to this, the Health Minister, Dr. Zweli Mkhize, is concerned about an increase in the number of unnatural deaths and non-COVID preventive behavior following the easing of alcohol restrictions. He warns that the threat of a second wave of infections remains very real. On a softer note, South Africa will be marking the 2020 International Literacy Day on Tuesday with the theme Literacy Teaching and Learning in the COVID-19 Crisis and Beyond. Part of the celebration will be the launch of a children's storybook on COVID-19 written by 2 teachers. One of them is former Miss South Africa for 2016, Ms. Ntandoye Nkosi Kunene. From Johannesburg, South Africa, Betty Dibia for the COVID-19 update.
Let's talk to Betty now. She joins us from the commercial capital of the country, Johannesburg. Nice to see you, Betty. Trust you're keeping safe. Let's talk about strikes. We have a strike ongoing, started today, resident doctors. You have a strike coming up, possibly?
We have the National Education, Health and Allied Workers Union, who have held a number of events, leading up to a strike that may happen on the 10th of this month. They're threatening, they've given government the ultimatum beginning last Thursday over issues from occupational health and safety, the odd wage increase here and there, and what they call the COVID risk allowance, which they expect. They also want things like a better process for procurement of PPEs for their members to ensure that fewer of them will be infected or will die. We have over 200 health workers who have died so far, and a few thousands have tested positive. So they're asking for a number of things. It's about 11 or 15 items on their memorandum of demands, which they've handed over to government. And they're saying if government doesn't respond within a week from that Thursday, they will withdraw their services from the different places where they're working. So, so far we haven't heard much. I know that in several occasions, the Health Minister, Dr. Zweli Mkhize, has said that he shares the concerns of the workers, but government is doing everything to ensure that they do their work on the front lines in safety, and they're looking into the issues, but we don't know who's going to blink first by the 10th.
Well, one of the things that will decide possibly who's going to blink first is the figures. It does look as if the figures have stabilized somewhat, but then there's still cause for worry.
There's cause for worry. The death toll has, a quick update on the figures I gave in that report. The death toll has risen to 15,004 today. We had 115 new fatalities. The active cases has gone down. We have almost 58,000. Right now you have 639 plus positive cases, but recoveries is over 500,000, of course, almost 570,000. So the cause for worry is the deaths, which is still going up. We've not had anything less than 100 for some time now, and that's a cause for worry. And then the issue of the unnatural death, since the removal of the restrictions on alcohol, you have what the minister has said, that unnatural deaths and reckless behavior by a number of people through accidents and trauma, has added to the death beyond the COVID related deaths in the country. That's a major cause of worry. But generally, for the first time today, overnight, from yesterday to today, we had a figure for new cases less than 1,000 for a very long time. We have 854 new cases in the country, and 2 of the provinces, Limpopo and Mpumalanga, have active cases less than 1,000. So it's looking positive, but the issue of the fatalities is still a source of worry for the government.
All right then, Betty. Cautious optimism would be in order then. Thank you so much for that update tonight, and do continue to stay safe.
Thank you very much. You too. Thank you.
Spain has become the first Western European nation to cross the 500,000 mark for COVID-19 cases. It reported more than 2,400 new cases in the last 24 hours, while 26,560 new infections have been registered since Friday, including today's rise. This comes as India overtook Brazil to have the second highest number of COVID-19 infections in the world after the United States. Here's the global update.
As the number of cases continue to grow in India, doctors say hospitals are struggling to cope with fatigue, exhaustion and manpower after nearly 6 months of relentless case increases. The total number of infections in the country have now passed 4.2 million, overtaking Brazil as a country with the second highest number of coronavirus infections globally. However, the metro in the capital, Delhi, has reopened more than 5 months after it was shut down to prevent the spread of coronavirus. Masks, social distancing and temperature checks are mandatory, according to new rules released. Over in the United States, the total number of COVID-19 cases surpassed 6.27 million on Sunday, according to the Center for System Science and Engineering at Johns Hopkins University. The national case count rose to 6.27 million, with the death toll in the country reaching 188,909 as of 11:28 p.m. on Sunday. Finally, China's National Biotech Group has found 2 more countries to run late-stage clinical tests of coronavirus vaccine candidates. Serbia will test 2 vaccines developed by CNBG's Wuhan and Beijing units, and Pakistan will test the Beijing's Unite candidate. CNBG says phase 3 trials are expected to involve 50,000 people in about 10 countries, including the UAE, Bahrain, Peru, and Argentina. Phase 3 trials usually require thousands of people to verify safety and effectiveness of vaccines.
And with that global update, we end our package of COVID-19 update for tonight. You can take a closer look at some of the numbers and the statistics as well as the stories by visiting our website, channelstv.com. You'll get more updates there and better understanding of all you need to do to stay safe during this period. And of course, there are stories on other subjects, politics, business, and sports. I'm Ladi Akiriduluale. Do have a good evening.